I'm Dr. John West. I'm a breast cancer surgeon. And today we have the opportunity to interview someone with a very important story. Barb, I've always wanted to ask you, what was it like when you were age 36? You're meeting with the oncologist for the second year in a row. You were asymptomatic. You're expecting nothing unusual, and he tells you, A, your cancer has recurred. It's metastatic to the lung. And B, you have only 18 months at best to live. What was it like?
Well, I think I went through the stages of loss and shock that most women do. The first reaction was, of course, just shock. How could this be? Because I feel perfectly fine. How could I have mets in both my lungs? Yeah. And then, of course, going through different stages, which is grieving, wondering, what am I going to do? How am I going to tell my family? What do I do about my job? What do I do about losing my hair? All of those things that women think about. And then anger is sometimes a stage that we go through. And sometimes we have to have time to sort of have a pity party. But then at some point, it's like, okay, now the choice is, right, how do I move forward? Right. What are my options?
I think that's really important to get each of these steps kind of defined. But what's in my mind is you're sitting there all alone. It comes with a total shock. I mean, you just
absolutely
say goodbye and drive your car home and go have a drink? Or, I mean, what goes through your mind? It must be incredibly stressful. Can you describe some of the feelings that you went through?
I think crying, obviously.
Yeah.
That's one of your first reactions. And then, like I say, trying to figure out what's going to happen to me? What's going to happen with my job? I was a teacher, but it was summer vacation, thank goodness, so I had a break and time to think about, what is chemotherapy like? Mm-hmm. We didn't have the advantage in those days of having other women that we could talk to, like we do now, that had chemotherapy. And so there was just so much overwhelming fear. I think fear is the overwhelming
but at some
feeling.
Point, you overcame that fear, and patients do.
Yes.
I mean, I see them.
Yes.
I can't believe what they're going through. I mean, I hate to tell them, the bad news, and it's. I know it's devastating to them, but at some point, I notice some take a short time, some take a long time. But somebody goes from being overwhelmed to becoming a fighter. They're going to survive. Was there a point at which was there a turning point for you?
I think it's a process, but I think one of the things that we know and why our support program is so critical is that we know women need to see other women that have done well. For me, what I wanted to do was to know that there are other people out there that have been given a terminal diagnosis of cancer and are still alive. And so I found a book called Cancer Survivors that had stories of people that had been literally given a terminal diagnosis and were able to overcome that, and they were still alive. And that's what gave me that first little window of hope. It's like, yeah, there are people.
Hopeless.
Yes.
And then it turned. And I always wonder how that happens, but there's a great example. I think other patients have told me that just prayer. One lady held hands with a large prayer group, and she said she could just feel the change, that somebody was looking after her and that she was not alone. And so I think each person is a little different, but I think maybe the message is for patients is that whether it's a newly diagnosed cancer patient or somebody with a devastating situation like metastatic disease, there is always hope. And we're making incredible progress, and we are really turning the corner on breast cancer. When you get the bad news, you don't think that way, but over time, there is reason for hope, and there's a process by which. So tell a little bit about the history. So you were, how did you end up with breast cancer in the first place? What caused this, or how did you find it?
Well, actually, I had a friend that worked for St. Joseph Hospital and was doing some research about breast cancer. And in her article, she was saying that, we have a lot of women younger in their 40s that have breast cancer, that breast self-exam is really important. And I was really just sort of, yeah, I'll do that when I'm older.
Like most women, huh?
Yeah, like most women. But at her sort of pushing me, I did some breast self-exam and I found a lump. And I went to my regular OBGYN, who had me have a mammogram that was negative because I was only 34. And he told me not to come back for a year, to forget it. I was too young.
Did he feel a lump, or could he
Oh,
feel
yeah.
it? He felt the lump and told you not to worry about it.
Correct.
Well, we've made a little bit of progress, but not a
Yes.
lot. So we still hear their story. Oh, honey,
Yes.
don't worry about it. It's fibrocystic, or you're too young to get breast
Correct.
cancer, or it doesn't
Yes.
run in your family. All these are myths. They're untrue, and they're devastating if you listen. So what happened? You ultimately...
Yeah, my friend pushed me to actually go see a doctor that was doing something that was sort of experimental at the time called thermography. It wasn't a definitive diagnosis, but he was like enough that he said, you know, you really should see a surgeon about this.
Good.
And the surgeon, you know, I was the best surgeon that I was referred to at the time, and he felt it and he said, oh, I can tell you 98% this is going to be benign. But I had the surgery anyway, and then at 3 p.m, he told me, well, it's positive for breast cancer, and your mastectomy is tomorrow morning at 7:30.
Now that's the bad old days. I mean, that's what we did.
That's the bad old days.
It's a step better than the decade before that, when you had the lump, you signed a consent. So a 22-year-old girl with an obviously benign lesion has to sign a consent for a possible
Right.
And they said, well, how do I know if I had cancer? I said, well, if you wake up with a big bulky dressing, they did a mastectomy, and if it's a little bitty dressing, it was a benign biopsy. So in your case, it's what we call the two-stage procedure, where they took the biopsy. This was before we had the core needle biopsies readily available
Correct.
to us. So we have, nowadays it would be a needle core, and you would have had an ultrasound in addition to the mammogram. But I don't think, it was 1981, I think, when you...
That's
is
correct.
that right?
Yes.
And so you had your mastectomy, and the nodes were negative, I think you told me.
That's correct. Yes.
So in those days, again, much different than today, where we know all about the biology of cancer, and we treat many women with chemotherapy that have negative nodes, but we didn't know that back then. So the rule
right.
is no nodes, no chemo.
Yes.
So
today, I would have been diagnosed as a triple negative. At my age, I would have had chemotherapy before surgery to shrink it down. But in those days, it was like you didn't have it in your lymph nodes, so I didn't have any chemotherapy at that time.
Right. And so you just healed.
Yes.
The drains came out. You were followed once a year, and your oncologist saw you. You were due to see on the second year, as I remember you telling me.
Yes.
And they ordered blood tests and a chest X-ray, and then you were going to go in a week later and go over the results. So you were going in just merrily, coming into the office all by yourself.
Feeling great.
Sat down in front of him, I assume, in his office. And how did the conversation go?
Well, I think because most of us, especially the first time, we can feel like, I did it. I did the surgery. I did what they want. It's behind me. And I didn't really do much emotional work regarding it. It was just, okay, I've moved forward with my life. It's over.
Yeah.
And then when he gave me that news, like I said, I think fear is just the overwhelming, you're just consumed with fear.
But you managed it. You dealt with it. You went through a difficult adjustment process, but slowly you turned it around, and then hope and prayer, I don't know what.
And I think the key word is process.
Process.
You know, you're not going to all of a sudden just say, oh, today I wake up and I have hope. I think it's up and down. It's like, okay, I've opened that little window and learned that people can survive this. What else is out there? If medicine tells me I have only 18 months to live with chemotherapy, then I explored things like Simonton's work that talked about guided imagery and some of the new techniques that at that time my oncologist said was garbage. But, you know, he didn't have anything else to offer me. So I was like, hey, I'm going to try everything that's out there. So I think it's a process. I think you have hope. Then you have days when you're back into fear or pity. Then you move forward again. And so slowly, you just keep, every time that fear comes up, you get to choose again. You get to choose hope. You get to choose something positive.
So you went through, of course, old-fashioned chemotherapy, stuff that we wouldn't even use or think about now. We would consider fairly ineffective for your kind of, but you did it.
Yes.
And then at what point did you get a repeat chest X-ray? When did you get this good news that things have cleared?
Yes, actually, he said, I'm going to do another chest X-ray in about 3 months. So at that time when he did, he said, wow, I can't see anything except for a little bit of, you know, fuzziness where that area was. And so, of course, because we didn't have any of the wonderful drugs that we have now to help with chemotherapy, and I was having the ice cap on my head that was popular at that time, I was like, great, I quit because this has been really hard. And he's like, no, you don't quit. We're going to complete this so that this never comes back.
But it did come back on the other side, isn't that right? About a few years.
That was a new primary.
I realize that.
Yeah.
But I mean, it's not less end of story. It would be nice to say it's never come back. I mean, that was really 35 years ago, about 1981. So I do the math, but it's a long time. And what was about
91? I had second primary.
Yeah. So.
And again, at that time, people ask, did your mother have breast cancer? Someone on your mother's side? And I would say, my father's twin sister, but they weren't interested in that.
Well, at that time, we didn't know it could run on the father's side. And I remember telling patients, "Oh, don't worry about your father's side." How wrong I was. I mean, we just didn't know. Well, fast forward to now, and just looking at your story, you've now taken over. You're the director of our volunteer support program. You see hundreds, if not thousands, of women who've been newly diagnosed with breast cancer. You've watched that group. You see how women can support each other, the value of a support group. What have you learned? Do you have some messages for newly diagnosed patients that you'd like them to think about and the importance of support?
Well, the reason we have our support program at BreastLink and Breast Care Center is that we know the power of seeing another woman in front of you that's been down that road, walked that path, and now they look great.
Yeah.
Here they are, not only surviving, but what we call thriving.
Right.
And that's powerful. And I'm sure you can see the difference between when you give them the diagnosis and they're in shock and they're so upset, and then they can talk immediately with another woman that's gone through this, that can tell them that they're going to make it. That is powerful. Right. And it's very powerful with metastatic, especially because with the first diagnosis, we're like, I can do this. I know other friends that have had it, or relatives or coworkers, or I've read so much. But the second time, it's a real blow because you're like, I went through all of this and it didn't work. And I just talked with a young lady yesterday and I said, what's your biggest emotion? And she said, anger. I'm really mad that this
Maybe that's better than fear. I don't know.
Well, it's a way to mobilize you because it's sort of like that. I'm mad as hell and I'm not going to take it.
Well, but there is, again, a process of working through these things.
A process.
Well, just to clarify, you talked about the volunteer support. So we have at our center, as you well know, and you started it, the volunteers, after a year, they can come back and be volunteers. And so when we talk to a patient, a newly diagnosed breast cancer, we have a survivor in the room. And then in addition to that, you have a support group where all of our patients are invited to come and share. Some of them have very low-grade ductal carcinoma in situ, totally cured, and others have more advanced breast cancer. Maybe a few of them have even metastatic problems. There's a bonding process, as I see, and a support process. And patients get a tremendous amount. So anybody who has these services available should certainly make every effort to take advantage, even the person that doesn't think they need them. I think I've not heard of a patient yet that hasn't found it to be a powerful, supportive experience.
Yes, and I think that's because you may know a coworker, you may know a family member, but that's not the same as what we keep emphasizing, and I know you say that, Dr. West, all the time. Your breast cancer is like a fingerprint. It's individual. So you need to make sure you're getting accurate information, what's true in 2016, not someone that had it 5 years ago, 10 years ago. And what I see is people that begin our support group, they're scared, they've often just been diagnosed, they're confused about all the terminology, what their decisions are. And over the process of those weeks with other women, all of a sudden they blossom. It's like confidence. Okay, I can do this. I understand. Knowledge is power. Knowledge is power.
So, Barb, I want to thank you for sharing these very personal comments. I know they're going to be helpful for women to have the opportunity to review the video. I think we as a closing message, we're making incredible progress in early detection, more effective treatment, fewer side effects. Now we're understanding the genetics. It's a big step forward, but there are some problems on the horizon, and it starts with our government. Right now, there's a major push to stop doing screening mammograms at age 40, and I think women are going to die because of this. So in the next segment, we're going to talk a little bit about this issue. It's important to every woman. Every woman who turns 40 should start having a yearly mammogram. But if we let the government take over, they're just going to stop paying for them until you're age 50 and then only pay every other year.